scenario number 7 here. What CPT and ICD-10 CM codes are reported? Your options are option A 31576049.1, option B 31541D49.1, option C 31540699990 D49.1, option D 3156356 D49.1. Preoperative diagnosis left vocal cord tumor, postoperative diagnosis left vocal cord tumor, name of the procedure, direct laryngoscopy with microscope, removal of tumor, anesthesia general, specimen, left vocal cord tumor pathology. A technique, patient was brought to the operative suite and comfortably positioned on the table. General endotracheal anesthesia was induced. The bed was turned 90 degrees clockwise. Alveolar guard was placed over upper alveolus to protect the teeth. Appropriate drape were placed. The anterior laryngoscope was inserted and direct laryngoscopy was performed with no abnormal findings other than above described tumor. The scope was suspended using a microscope, operating microscope. The anterior vocal cord tumor was removed. The mucous membrane posterior to the tumor was carefully incised and Ricci space was entered. Careful dissection allowed mucous membrane elevation of the anterior vocal cord up to the scope was gently up to the commissure with what appeared to be a complete excision of the tumor. Minimal bleeding was noted. The area was sprayed with cytokine spray. The scope was gently removed. The teeth were evaluated and found to be free of injury. The drapes and the instruments were removed. The patient returned to the anesthesia for care, allowed to awaken, extubated, transported in stable condition to the recovery room. The patient tolerated the procedure well. Findings: a patient is a pleasant 77-year-old white female with history of above noted diagnosis. Operative findings included an otherwise normal larynx, with the exception of left anterior vocal cord tumor. It was fairly soft, and what CPT and ICD-10 CM codes are reported. So coders, see you after the time. Okay, so good one. You all are rocking it in the chat. And Curtis, if you want to take a screenshot of the scenarios, please go ahead and take a screenshot, and you can maybe look into it later or work on it later as well. So good answers, by the way, in the chat. So we have a preoperative and postoperative diagnosis, same, which is a left vocal cord tumor, direct laryngoscopy with microscope and removal of tumor performed, general endotracheal anesthesia, anterior laryngoscope was inserted, direct laryngoscopy, scope suspended, operating microscope, complete excision of the tumor. The correct answer, as most of you have said, I can see only one alphabet in the chat. Way to go. So correct answer is going to be option P. And this is how we got into the answer. We have procedure inventory, removal of the tumor by direct laryngoscopy with microscope, and diagnosis inventory. We have left anterior vocal cord tumor. So option A is coding for laryngoscopy flexible with biopsy. Okay, so an option D is also coding for 31536, which is for laryngoscopy direct operative with biopsy. So why is option A and D incorrect? Is that with operating microscope of the telescope as well for 31536, because it was not a biopsy procedure which is performed. We can see a complete excision of the tumor was performed in our scenario. So yes, definitely after excision we might send for the biopsy, but again the reason for the procedure or the main objective of the procedure was not a biopsy, it was a complete excision procedure. So that's why option A and D are incorrect, both are coding for a biopsy procedure. Option C is coding for 31540699990, which is for a laryngoscopy direct operative with excision of the tumor and stripping of the vocal cords or epiglottis, and 69990 is for an use of operating microscope. Um, Part of this portion question is our code is correct, but we should not use 69990 here, because we have a more specific answer in the CPT code, option B 31541, which is for a laryngoscopy direct operative with the excision of the tumor. Yes, cross checking with the procedure inventory, we had an excision of the tumor performed, and also a operating microscope was also used. So 31541 is also coding for use of operating microscope. So we have a specific code here in option B 31541, and that is why option B is the correct answer. So how are you feeling, coders, after scenario number 7? Please do let me know in the chat. Good, great. Did the explanation help? Okay, good. So we are moving on to, that was supposed to be my final question, since we have 17 more minutes left. How about a bonus question? Are you all ready for one more scenario, a bonus scenario, or a bonus challenge? Okay, are you ready, coders? Yes, let's do this. Okay, this is your question. What is the correct code selection? Option A 12031 12013 59 modifier S01.21XA S61 4.419A W21.03. Option B 12041 12011 59 modifier. Option C 12013 59 modifier 12041. Option D 12041 59 modifier 12013. And question is, 25-year-old woman presents to the emergency department with a laceration to her face, hand, and nose. The patient reports that she was hit with a baseball. The physician performs simple repair of the laceration of the face of 2.6 centimeter on the face and 1.3 centimeter on the nose and 1.5 centimeter intermediate repair of the hand was performed. What is the correct CPT code selection? What's the correct code selection for this scenario? And your time starts now. Okay, Koda. So this one is a good scenarios. I'm looking into your chat. We do have a split in answers, and why is this good answer a good scenario? Because this helps me to have a look back into the FDRs, the guidelines on the repairs. So let me walk you through this one. We have a laceration to the face, hand, nose, and 2.6 centimeter of laceration repair on face and 1.3 centimeter on the nose was performed, and 1.5 centimeter of intermediate repair of the hand was also performed. The correct answer is going to be option D. And so let me first bring up our FTRs. So we have CPT codes of 12001 to 12021 for simple repairs. Intermediate repairs, the codes are 12031 to 12057, and complex repairs are from 13100 to 13160. The first thing which we have to look is to see the type of the repair. Is it a simple, intermediate, or complex repair? So we had a simple repair, I think. Yes, we had intermediate repairs as well. So add the closures of the same complexity and body areas code according to the size of the repair, sequence the most complex repair first. So these are our FDRs, and this is our procedure inventory. Okay, so this is our procedure inventory as well. So now let's look and let's eliminate the wrong answer. So option A is coding for 12031, which is for repair of intermediate wound, scalp, axilla, trunk, and or extremities, excluding hands and feet. So this one is incorrect because it's coding for an intermediate repair excluding hand and feet. Well, we had an intermediate repair of hand, right? And that's for 1.5 centimeters. So it is wrong because that's for a wrong location, and the correct answer would be 12041. That would be repair intermediate wound of neck, hands, feet, and or external genitalia to 2.5 centimeter or less. Now again cross checking with the procedure inventory. Yes, we had intermediate repair of hand, and this code option 12041 is coding for the correct location. Okay, is that clear, coders? Okay, so let me move on. And in option B, the next code option is 12011, and that is coding for simple repair of superficial fluids of face, eyes, face, ears, eyelids, nose, lips, and or mucous membrane, 2.5 centimeter or less. So why is this wrong? Because we have to refer to our FDR for this. The bullet point number 2 states that you have to add the closures of the same complexity and body area. So we had a simple repair of face and nose. Both belong to the same, both have simple repair. So they have same complexity and same body area. So we have to add the repair of face and nose. So the correct answer would be 2.6 plus 1.3 centimeter. That would give us a total of 3.9 centimeter. So the correct answer should have been 12013, which is for simple repair of superficial wounds of face, ears, eyelids, nose, lips, and or mucous membrane, 2.6 centimeter to 5.5 centimeter. So that is the correct answer, which matches the size of the wound repair as well as the body area and the complexity. So option B is also incorrect. That's coding for a long CPT code, and between option C and D, both are same, having same CPT codes. Only difference is in the sequencing order, right? So 120 option C is coding for 12013 followed by 12041 and a 59 modifier, while option D is coding for 12041 followed by 12013 with a 59 modifier, and that's where we had a split as well. So the CPT codes are correct. For selecting the correct answer, which is option D, we will have to refer to our bullet point number 4 from the FDR, which says that sequence the most complex repair first. So we had a simple repair and a intermediate repair. So which one is more complex? Is simple repair more complex or intermediate repair more complex? Let me know in the chat, coders. I'm not sure. The chat is quiet. So are you able to follow me, coders? Okay. Now I can see the answers. I, I thought like my chat got frozen. Okay, yes. Intermediate repair is a more complex one than a simple repair. So that should have been sequenced first, and which is the reason why option C is incorrect and option D is the correct one, because 12041 that's for an intermediate repair and 12013 which codes for a simple repair. So we have more complex repair sequence first and less complex repair which is sequence second. That's why we selected option D as the correct answer. How are you feeling, coders? Please do let me know in the chat. Did the explanation helped? Okay, only few answers in the chat. How about the rest of the students? How about the rest of the class? Please do let me know so that I can help you out. Okay, great. Okay, good. So with that, we are coming to an end for this first week of study session. So once again, coders, please do review your FDRs and thank you very much for attending the week one of the group studies. And we will be joining back for the next group study next week on Tuesday night, the same time. So till then, coders, keep coding, keep churning, and stay safe. See you all next week. Have a great week ahead. Thank you for joining once again.
Thanks for tuning in, and until next time, happy coding!